Hi everyone, in this video we're going to be talking about how to place a rubber dam on our typodont. Rubber dams are not the funnest thing to do for most people, and they're definitely not a fun thing to have on. So the more confidence you can have as an operator placing one, the more comfortable your patient's going to be. When I was a dental assistant, my dentist that I worked for used a lot of rubber dams. And they are really helpful for the operator because you don't have to deal with the tongue and the cheeks. Like, it's a very clear field, super easy to work on, and makes things really fast. And as a patient, even though it's uncomfortable to have on, you're not dealing with like all of the, the drill debris in your mouth, and you don't have to deal with all that water. So it's a little bit nice for the patient in that respect. So you don't have all the debris in your mouth. But again, they're not super fun to place. I've placed literally hundreds of rubber dams, and I kind of like placing them now. I feel like it's like a little bit of a challenge. And when I was a hygienist, I would sometimes help the dental assistants that didn't have a lot of experience with them place them as well. So once you get the hang of it, they're really not that bad, and they're super helpful as an operator. When you are placing a filling, you will be grateful to have a rubber dam in place because you will be able to place a much better filling that way. So when we place a rubber dam today, I am not doing this the ideal way. So I don't have a mounting rod at home. So making this video, I am going to have to place my rubber dam tabletop. So on my desk here with my typodont sitting here. I would recommend for you at home to put your typodont on your mounting rod. So have your typodont, the maxilla attached with the screw, with the springs, and actually have it, open like a real patient. I actually think that'll be a more realistic experience, but honestly, I think that will probably be easier than doing it tabletop. So I would recommend that. So we'll see how this goes with me doing it this way. So when we are placing a rubber dam, we want to make sure that we know which tooth we're working on. So I'm going to say that today we're going to be working on the lower left. I'm going to say, let's say we're working on tooth numbers 19 and 20 for this patient today. So we need to know kind of what we need to punch as far as our rubber dam goes. This is going to vary depending on the operator that you are working with. I know that the dental assisting textbook, that they say that you should go, like if we were working on the lower left here, we would clamp the most distal tooth, which in this case would be number 17, and then you punch and place your dam all the way to the opposing canine. So you're doing the whole quadrant plus the other anterior teeth. So that's a pretty large rubber dam. I think in the restorative clinic, they typically have you place your clamp at least, I think it's at least 1 or 2 teeth distal, and then you have to have like 2 teeth mesial to that. So your rubber dams are going to be pretty small. For this class and for our kind of training purposes and practice, what we're going to do is we're going to place rubber dams for full quadrant. So we'll clamp the most distal tooth and we'll go all the way to the midline for our rubber dams. So just full quadrant, and then depending on the situation when you're in restorative clinic or the dentist that you're working with, you can place it otherwise. So you'd want to always kind of check that with them. Okay, so I've got a piece of the rubber dam material. This is latex, so if you have a latex allergy, do wear gloves when you're handling this, and you should be fine. You always want to make sure and check with your patient if they have an allergy, because obviously you don't want to put this on their mouth. There is non-latex rubber dam material, and we do have some in the clinic, but if you've ever worked with the non-latex material, it's thicker and it's kind of like slipperier, and it's much harder to work with. So this latex stuff is just way easier. So that's why you're using it, because it's going to be a little easier for you if you've never done this before. Then you also have this little like guide, and this is going to be how you mark the areas that you need to punch out on your rubber dam. So like I said, we're going to be working on, for our purposes, we're just going to do full quadrants. So you obviously know your quadrants, so you're just going to use whichever quadrant you're going to be working on. once you do these quite a bit, you may just decide you don't want to use this little template. I very rarely use this in real life. I just start punching, because once you do it a bunch, you just know what to do. So what you want to do is you want to basically center this on your rubber dam material, and then you want to take a pen and mark the areas that you're going to end up punching. I'm going to use a Sharpie because I'm hoping that that's going to show up a little bit better on this video. But you want to mark all of the dots for the teeth that you want to punch. So you don't need to do all the whole mouth. In this case, like I said, just the one quadrant. But if you were working on more or less teeth, then you could just do those teeth. Okay, so there we have the quadrant. So now we are going to be ready to punch. So we did the lower left quadrant, and so you'll see that this would go on the patient's mouth like that. And the patient, you know, if their upper jaw is there, this would be kind of stretched, and that's how it would be. So now we have to actually punch these areas of this material out. So this is a rubber dam punch. You may have one that looks slightly different. It's a different model, but they work the same way and they do the same thing. Some of these have seen some better days. These have been used for a long time. A lot of students have used these for practice, and so some may work better than others, and I'll kind of try to help troubleshoot some of those things as we go along. If you look here, you'll see that this little wheel, you can turn it so that you can go to the different sized holes. Something that does help is, like, if you see in this hole right here, see how there's like a little green thing? That's a punch from a previous rubber dam. If you see little pieces like that, if you can get those out before you start punching, you'll be more successful, because those can actually interfere with a new punch. Like if I went to go punch that same hole right now, that would kind of get in the way and my punch might not be perfect. And it looks like I've got two little pieces in there. So I'm gonna go ahead and get those out. You can use like a paper clip would probably work great, or some other like tiny tool. So I'm just going to use a paper clip and just kind of push those out. So yeah, so those came out. Okay, so that looks much better. My little holes are clear. Oh, there's another one. Usually people don't do this because they're in a hurry and they're, you know, doing lots of stuff, but you will get a better result if you clean those out. Okay, so now these little holes, each one kind of corresponds to a different tooth, and you may find that you have personal preference and you don't necessarily have to use the sizes that are recommended, but I would recommend that you do, just to start out. So you want to always start with the largest hole. Now the largest hole is going to be for whatever tooth you're going to clamp. So in our case, we are going to be clamping the most distal tooth. You're always clamping the most distal tooth. You know, you may be punching your dam differently. In our case, we're going to go all the way to the wisdom tooth. But like if you were only punching your dam to tooth number 19 for whatever reason, preference, then that would be your tooth you're going to clamp. So that one you would punch with your largest hole. In our case, we're going to number 17. So I'm going to punch number 17 with the largest hole. So I'm going to take my material, make sure that you have your largest hole right under the punch. So right in the center there. And then you're going to take your material. You're going to take the little point right in the center of it, and then you're going to push and punch. I'll make a nice little snap. And then a good punch means that it is punched. There's, you know, it's punched all the way through and it looks really clean, and there's, you know, not a little piece hanging off of it. We'll see. Hopefully I can actually get some bad ones so I can show you what those look like. So that's our first punch. Now we're going to rotate this to the second largest hole, and that's for molars. So now I've got 2 molars that I need to punch. So my next 2 holes are going to be with that punch. So I'm going to get my material in, and I'm going to do 1 and 2. Good, nice and clean. Now I'm going to punch my premolars. So I'm going to use the next largest hole for premolars. Okay, very good. And now I'm going to go to the next one and do that for the canine. And if I was working on the maxilla, I would use the same punch probably and do my anteriors because the upper anteriors are bigger. But since I'm on the mandible, I'm going to go down 1 more and use that smaller hole for these next 2. Okay, so you can see that the holes get smaller as we go down. So now let's talk about what if you punched all of these with the largest one? So what if you didn't change it? Well, what happens is if your hole is too large, even though you're going to be stretching these around the tooth, you will most likely get gaps, which equal leaks. So that's going to be the bigger concern, is not that things are going to leak through to the patient, but that their saliva is going to come up and you're trying to get a dry field. So if you're working on a composite, you don't want saliva leaking up through to where you're working, because that's going to interfere with your filling and not be good. If you punch the holes too small, you are going to have a heck of a time trying to actually stretch them around the teeth. So you want larger holes for larger teeth, smaller holes for smaller teeth. That's the purpose and why the punch has different hole sizes. You never want to double punch a hole. I shouldn't say never, but you ideally don't want to double punch a hole. If you punch things more than once, it's more likely that it's going to make the rubber dam so that it could tear. It could just tear easier. So don't double punch. If you get a little hanging piece, let me see if I can punch a little spot somewhere. See if I can do a bad one. No. Yeah, this one's working too good for me. But what I want to say is, like, sometimes you'll punch and it won't punch all the way through. So you'll have like the little piece is kind of like hanging on by like a little, little thread. What you can do is grab the piece with your fingers and give it like a really quick tug to pull it off. But what you want to do is you want to check and kind of like pull afterwards. And what you're looking for is you want to make sure there are no rips, because if you tug it like this and you can see a tiny rip, what's going to happen is when you go to place this on your person or your typodont, then it's going to like tear. The whole thing is just going to tear open. And so you're better off, if you've got some rips, just punching a whole new one so that you don't run into that problem. Okay, so you want nice, clean holes. And if you have any little parts that didn't punch all the way, you don't want to put it on your typodont or your patient with like little pieces hanging off. So you're gonna wanna like pull those off if you have that happen. Okay, so now let's talk about how we put this on. So there are, again, there's different methods for doing this, but we need to have our clamp ready. We can't just start putting this on. We need to have our rubber dam clamp. So we'll look at our clamps. In your kit, you have like 4 or 5 different types of clamps. And in your lecture and your reading, you should know a little bit about these different types of clamps. This one here, if you have one, this is an anterior clamp. Some people call it butterfly clamp. So this is specifically for anterior teeth. We're not going to mess with that. And then you have these posterior clamps, and you have everyone's going to be maybe a little different. You have clamps with wings and without wings. So you can see these have little wings that hang off the side. This one does not. The little wings help to kind of just push the rubber dam material down. And these are just a little bit more compact. So again, it's kind of going to be personal preference. And it depends on multiple factors why you would choose one over the other. In this case, what I want you to do is choose one that's going to fit the tooth you're working on. So like these two clamps are molar clamps, and this one is a premolar. And you can see because this is the area that the tooth goes in. This is very small, whereas this area in between the prongs is wider. So that's going to be a premolar versus a molar. So you want to make sure to have a molar clamp. Let's look at this one. This is probably a small molar or premolar. But these two are going to be molars. So you want to find something that's going to fit the tooth you're working on. And you always want to try on your clamps before you choose one. So you want to try it on your patient to make sure you have a good fit, because your clamp is what's basically the anchor of your rubber dam. And if you have a poor fitting clamp, the biggest risk is that it's just going to pop off your patient's tooth, which is no good, because then you have a flying piece of metal, or it could go down their throat, you know, things like that. So you want to try them on. Before you try on a clamp, you always want to apply what's called a ligature. So you're going to take a small piece of floss. It needs to be long enough so that if you double it, it's going to hang out of your patient's mouth, because it's the purpose of it is that if the clamp drops in your patient's mouth, you can grab this floss and pull it out of their mouth. And to apply a ligature to a clamp, what you're going to do is this is the way to do it. You're going to fold it in half, and you're going to take the looped end, and you're going to put it here on this part of the clamp, which is called the bow. And you're just going to stick the ends through the loop. Like that. And then just pull. Now notice I did not take this floss and tie a little knot around the bow. I just did the little loop and then put them through. Why? Because when I'm done with this clamp, I need to take this gross floss off. And so it's very easy to just then pull it off like this. If I've tied a knot in it, I'm gonna have to get scissors, and you know, it's a whole pain. So this is the proper way to apply a ligature, and you want to apply it to the bow. I've seen people sometimes put it through the little hole on the wings here. No. You don't want to do that, because that's just going to be a little bit in your way as you're working. So you always want to apply it to the bow of the clamp. Okay, so then we are going to try on. We're going to do a test fit. So you want to take this. This is your rubber dam forceps, and these little ends, these actually go in those little holes. So you're going to place the ends in the holes like that, and then you squeeze and the clamp opens, and that's what you're going to go around the tooth. So I'm going to bring my Typodont over, and the bow, this is how you always grab it. And you'll notice that the bow is sticking out here, not over here. So this is correct. And that bow is always going to go distally in the mouth. So it's not going this way. It's always going this way. And so the proper way to place a clamp on a patient is you want to squeeze and open. Then you're going to take the lingual surface and you want to put it down by the gum line, like right up next to the gum line, and then rock it over to the buccal and then let it go. Okay, now see how the curve of the clamp really fits nicely around that tooth. It's down all the way to the gum lines, and then you want to kind of wiggle it. You want to wiggle it, and you want to make sure that it's pretty secure. So if it's loose, if you can wiggle it and it comes off, it's not a good fit. You want to make sure that it fits really snug. Now, these clamps have been used for lots of practice on Typodonts, so yours may be a tad bit stretched out, so they may not fit quite as ideally as the ones we're going to use on patients, but you still want to make sure that it fits the curve of the tooth well, and that it feels fairly snug, that it's going to stay on your Typodont. Let's look at another one. I'm going to go ahead and take that one off. I'm going to put on this other molar clamp, this one with the wings. So again, I'm going to take it from the lingual. I'm going to place it down on the lingual, rock to the buccal, get it down on the buccal, and then I'll bring this off. I'll give it a little wiggle to make sure it's secure. And you can kind of see how those wings, once I have a rubber dam underneath of it, the wings kind of are going to push it out of the way for me. And then let me show you one that does not fit good. So this is the premolar clamp. Okay, so see that? You see on the, that's not a good fit. See how those curves are just, that's just too small of a clamp. So that is not going to stay on the patient. But if I did take it up for a premolar, see how nicely that fits on the premolar. So different clamps for different teeth. I am going to go ahead and use that first one today. Now there are two ways to do this. I'm going to show you both ways. I'm going to show you one way and then I'll show you the other way. So the first way is that you're going to put the clamp on and then the rubber dam over it. The second way is to put the rubber dam on the clamp and put it all on in one piece. And this is kind of a personal preference type thing. So you can do whichever way works for you. So first thing I want to do is put my clamp on. And then I'm going to take my rubber dam material. You want to make sure you've got it like the right way, you know, make sure you orient yourself and know where you're putting it. And then what I'm going to do is I'm going to take that last hole, which is going to go around the clamped tooth, and I'm going to stretch it over the tooth. So see, I put the whole thing just right over it. So that's one way to do it. Now I'm going to go ahead and I'm going to take the clamp off and I'm going to show you the other way to do it. So now the second way to do it is to take your clamp, orient it the way it would be in the mouth. So this is how it would go in the mouth. Orient your rubber dam. And then what you're going to do is you're going to take the clamp and you're going to stretch the material around the bow of the clamp. Okay, so I've just got it around the bow. So this part is hanging out the bottom. And this is around the bow. And you can see that the holes are still going the correct direction. Then what you do is you just kind of get the rubber dam material together and get the ligature up there with it as well. So I've got all that together. Then I'm going to take the forceps. I'm going to hold this, go into my patient's mouth, go lingual, and then buccal. Give that a wiggle, make sure it's secure. Unfold the material, and then you're going to pop it around the whole clamp and tooth. My personal preference is the other way. I like to put the clamp on and just stretch the material over it. I feel like I just get a better, you know, I can really make sure that the clamp is seated, and I feel like it's easier, but you know, like I said, it's totally personal preference. So now once you're at this point and you've got the clamp on and you've got the material stretched around the clamped tooth, then we're going to start working on actually placing it around all the teeth. So the way that we're going to do this is you start by using your fingers to get each piece around a tooth. And again, there's definitely different methods to doing this. What I like to do is go tooth by tooth and floss as I go, because that makes me feel that I've got it all secure. So you're gonna get it around the tooth, and then what you need is, see how this, between 18 and 19, it went all the way down past the contact area, so it's down by the gums. This piece is caught up in the contact area because that's a tighter contact there. I need to get that material down, so that's what my floss is for. So you want to have your floss really nice and tight in your hands because you're going to have to use quite a bit of pressure here, and you're going to go down on top of the material, wiggle, and floss it down. See how that one went right down? Good. Hopefully we'll get a hard one and I can show you how to, some troubleshooting here. I'm going to go around this one. See how that's not, like, it kind of looks from the top that it's down, but when I look from the side, see, I got to floss it down between those contacts around number 20. So I'm going to take my floss, go down. If it doesn't go down on the first floss, what I like to do is then take my floss and wrap it over a second time. and then go down again and then pull the floss out. When you are flossing a rubber dam down, you don't want to pull it back out, because if you're having difficulty, and on a patient you will, if you're having difficulty getting it down, if you pull it up, there's a chance that you're actually catching the rubber dam and you're gonna work it back out. So you always want to just pull the floss out the side. And to save time, I like to just double over it and then pull it back out. All right, so we need to get this mesial side. That's down. And sometimes you kind of have to see how I'm like holding it with these hands, and then I'm gonna like, there's different techniques, and it just, if you do things with your hands a lot, you will be like, if you do lots of little crafts and stuff, you'll probably be better at this. But it takes some practice, and dental assistants do this by themselves. You guys in clinic, you will be doing this like with each other. So you'll have an assistant working with you, and they can help you like hold the material down while you floss and all that. But yeah, it's good to know how to do it by yourself. Okay, so then once you have all of the teeth flossed, and so you look at the side and you make sure it's down nice and low all the way to the gums, past all the contacts, you can see through those embrasure spaces. That is a properly placed rubber dam. And then what you have to do is at the most mesial area, you have to place like some kind of a wedge or like something there to hold it down, because it can pop off and it can start to come out. So you always need to place something there. There is a product called Wedget, which is like a little rubber, it's like a thick rubber piece of floss that you can put down there, and it's like specifically marketed for this purpose. But there's two other easy ways to do it that won't cost you anything. So the first one is to use floss. So if you're gonna use your floss as a wedge there, then what I like to do is go like that, double it over to make sure it's gonna hold. This works great for like really tight contacts, which typodonts don't have that tight of contacts, but humans do. So floss usually works great, but you wanna double it over and then snip it. So you'll see that I've got the two little ends on the inside, and then I've got the little tail on this side. So then when you go to remove it at the end of the appointment, you just grab the little thing and boop, pull it right out. The other option is that you can take your scissors and go to the corner of your rubber dam, because you don't need a corner, and you can just cut a tiny corner off, and then you just stretch it, and you stretch it nice and tight, wedge it between, and that will hold your dam in place. And that especially works well if you've got a wider contact, which our typodonts do have typically. Okay, so once it's all down in place like that, then we need to apply our frame. So this is a rubber dam frame. They come in metal and plastic. There are different types. Anyway, okay, so let's place our frame. The proper way to place a frame, and it makes a little bit more sense when you're actually on a human and they have, you know, a mouth as opposed to just my typodont laying here. But what you want to do is you want to hold it this way so that the top prongs are up here, and you want to squeeze it together a little bit. So you want to squeeze it together, and you want to place it near the top, and then let it go, and see how it kind of stretched the top when I did that. So kind of squeeze, place, and then let go, and it stretches out the top, and it kind of, these little prongs attach to the rubber dam. And then you want to take the corners and you're going to stretch them like that. And then there's also some little prongs on the side, so you just want to stretch it and grab those as well. And then there's one at the bottom. I'm going to stretch that. Okay, so you can see now it's nice and snug. this is kind of wonky. Like, see how this is like touching here? This shouldn't be like this. So I'm gonna kind of reposition a little bit. Kind of get that out of the way. And again, it's weird doing this on, not on a human. On a human, it would kind of be like this, and it gets nice and tight. And so you have this really good surface here that, you know, is going to stay nice and dry for you. And then the assistant can come in and they can push down on this and create a little well for all the water to go into, and, you know, suction, and it's way easy. After you do this, there is one last step that you want to do. And this is kind of, whether or not people do this all the time is kind of hit and miss. But you see how, like, this is good. So this premolar, see how the rubber dam material is kind of what we call inverted. So it's kind of like tucked under itself. Whereas this one, it's kind of up over the tooth. What you want to do is take a Greg and actually invert the material around the gums. And this helps to prevent leakage, as well as just make sure that the material is really out of the way. So see how I kind of tried to flip the material under on itself. And so I use the Greg and I just kind of go under. And this is just called inverting. You can also use the Greg to kind of just go around and make sure that, like, it's really like out of the way. Ideally, you don't want like bunching of the rubber dam, so you can kind of try to move things around. And like, if you're working on these back teeth, I wouldn't like worry about inverting the front too much, but you want to just make sure that it looks really good there. Okay, so that is how you place a rubber dam. Now let's talk about taking it off. So there's a really specific way that you're going to take off the rubber dam. The first thing that you're going to do is you want to take off the frame. Okay, so let's talk about taking off the rubber dam. Again, there are different methods that different people use to do this. What I like to do is leave it all on like this, and I start by just taking off this little anchor or ligature in between the midline there, or whatever tooth you've got it on. So take that off, whether it's rubber dam, floss, wedge it, remove that. And then what you want to do is take your scissors and you're going to cut the septums. So you're going to cut the little piece of rubber dam that's between each tooth. And the best way to do that is to go to the lingual, and you want to pull on the material and then cut those little spots. So I'm going to go, sorry, trying to videotape this is a little weird. You're going to go to each one and cut each one. The big goal here is that you want to remove this in one single piece from your patient's mouth, because you don't want to lose little pieces of latex rubber dam in your patient's mouth or get them caught in between your patient's teeth or anything like that. Cut this last one. So you've cut all the septums in between the teeth. And then what you'll do, and let me stop. So you might say, well, why don't you just take off that frame and then do it or something like that? Well, one, if you leave the frame on, it's easier to stretch the material and cut those areas. But also, as soon as you take this frame off, you know, your patient's been sitting here with this rubber dam on for a while. They've got a lot of saliva built up. That rubber dam just kind of collapses in their mouth, and they start to kind of be like, you know, like what, like get it out of my mouth, and you're trying to work and it's not very good. So this way it just keeps it out of the way, out of their mouth. And then, so cut the little septums, then you're gonna go in with your forceps and you're gonna go back into the little holes of the clamp. You're gonna loosen the clamp, and then you're just gonna pull everything off their mouth all at once, like that. Then what you're gonna wanna do is take your mirror, and you wanna go around and you wanna look in every single interproximal area to make sure from the buccal and lingual make sure there are no rubber dam pieces that got caught in there, because patients have a lot of times really tight teeth, and even though you've cut all those septums, sometimes when you go to pull it off, like a piece gets caught and like actually will break off in between their teeth. So you want to make sure there's nothing left in there, and then you want to go back and floss as well. And if they do have anything stuck in between their teeth, floss is the way to get it out. So you'll floss down and kind of wiggle it, and then hopefully you can pull it out. But if there's any missing pieces, you want to make sure to find those. Then best practice, once you've done the process, is to take your rubber dam material off the frame, lay it down, and you want to look at it. And you want to look and see if there's any little pieces of material missing. So like I just said, like when you take it off, sometimes it can stick in between your patient's teeth and it'll be stuck there. So what you want to do is account for any little pieces. So, you know, let's say a little piece did pop off, then you want to make sure that you find it and say, okay, there's a missing piece and I found it, so we're good to go. Because you don't want little pieces of latex stuck in your patient's mouth. Okay, so that is how to place a rubber dam.